Guys, welcome back to Medical Coding with Blue. Today's episode is all about alternative jobs for new medical coders, what you should know. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I've done this video before about alternative jobs for new medical coders. So what alternative jobs are, it's not a coding position per se, but it does utilize your skill in coding so that you can get some substance onto your resume. And so that way you can break into the industry that way. Sometimes people have to do that because for whatever reason, either their resume is not getting them hired, they're not passing assessment tests, whatever the reason may be, they just can't get into coding, but they need a job right now. So what better way than to resort to an alternative job that's going to get you that experience and get you those connections, okay? So I did that video, and I also have done videos to jobs to avoid. So the jobs to avoid are jobs that are not going to utilize your skill, but sometimes people will resort to these jobs because it's just a foot in the door job just to kind of get them into the system, and that's how they figure they're going to work that way. But the only problem with that is that sometimes people get stuck in those positions and they don't continue to study. They actually end up losing their skill, and then they end up in that position for longer than they expected because they either stop looking for a job, they stop studying, and then they forgot, and then it's just like all these months go by and then they lose all of their skill. So I recommend certain jobs to avoid. Now I'm going to talk a little bit about both of them today, but I want to address this comment because, of course, as you know, my episodes are inspired by you all, the viewer. But the thing that I want to say first is this. Yes, getting into medical coding is somewhat of a challenge. And the reason that it is because there's so much that we have to know. That's why a lot of these companies always demand that they want the person to have experience. But having experience isn't always everything. Because sometimes even veteran coders who have years of experience can start to lose their skill because they get into the same type of clinic and the same type of coding, and then by the time you know it, they have forgotten all the other aspects of coding. Versus the new person that's coming in and they have all of this brand new skill and this, brand new learning and everything like that. And so, but it's just a matter of giving them a chance to get in. I always say this, and for some reason people stop listening on this part, but I need y'all to hear me, please. Because I always get the question, how am I supposed to get experience if no one will hire me? You apply anyway. You apply, you keep applying, you get out there with a good resume, and you apply. And you are intentional when you are applying for these jobs, right? What you want to do is you want to make sure that your resume and your cover letter are reflective of the skills that you have that employer is looking for. Because sometimes with these employers, they're asking for different things. And if you have none of those things on your resume, that ATS reader is going to pass it right on by. Okay? So that's the thing. So it may require you to update your resume every single time you send it out and your cover letter with the job title. Okay? And then you're going to make sure that whatever skills you have that they're asking for, that at least some of that is on your resume as well. And a lot of people don't want to do that. They say, well, Blue, I don't want to have to do that every single time. If you want to get in, that's what you got to do. It's not a negotiation. It's not a, I want this, I want that. When you're brand new, you got to take what you get. Okay? So, and I'm just telling you guys because this is the way that it is. I even went through this when I very first started. But I went to the temp agency and they were able to hook me up with a job. Now, every time I always mention the temp agency, I always get somebody real smart coming in saying, I don't want to work a temp job. Well, I didn't want to work a temp job either when I first started. I wanted a real job because I knew everything, right? But it wasn't until like my school principal who recommended this temp agency that specialized in medical professions. He said, well, the more experience you have on your resume, the better your chances of getting in, because at least it's something, okay? Because you're supposed to ignore it when it says they want 3 to 5 years experience, and you're still supposed to apply anyway. That's me telling you all that, okay? That my principal didn't say that. I'm telling you guys that when you see that job listing with 3 to 5 years experience, you're still applying anyway. And so doing all those, doing that temp job, which was 3 months, and then I got put on another assignment, and I was only there for 8 months, and then I got here to my forever home. So it's just a matter of kind of thinking outside of the box, and that's what these videos are. Thinking outside the box, and then trying to help y'all to keep y'all from being taken advantage of and having your skills taken for free. Because you don't work for free as a brand new coder. It doesn't matter that you don't have experience. Oh, I want to volunteer. You have a trained skill that you paid for, or you are in debt for somehow, some way, right? So that's the thing, guys. You cannot be giving away your skills for free in a multi-billion-dollar industry like healthcare, period. Okay, that's the thing that I will always recommend, is that new coders never ever work for free. All right, it dilutes your value in the industry, and you don't want that. Okay, but let me read this message, and then we're going to get into it. So here we go. So the patient, and then I'm going to say provider. Oh my goodness. The person says, I had an interview for a medical account receivable position last week with my CPC cert and got rejected due to no experience working on hands-on, they put on hands, but hands-on with insurers. I thought it would be easier position to get started with, but that was not the case. I did not want to work in medical billing department, so I'm okay with it, but I'm just concerned how I can actually get my foot in the door. First of all, if you really don't want to work in billing, don't apply for billing positions. Do not apply for billing positions, because there's somebody else out there that does want to work in that position. If you do not want to work in that position because of whatever preconceived notions that you have, then don't worry about those positions. Do not apply for those. Because if you're walking in and you're thinking, oh yeah, I've got my CPC, I can get this. No, if you're not really appropriately selling your skills when you're in that interview, no, you're not going to get the job. Because a lot of times medical billing positions, sometimes they will say they want you to have experience, but a lot of times when I'm looking at these job listings, it's saying that they're willing to train. So it just really all depends. And maybe this was a remote position the person was trying to apply for, because y'all seem to like those remote positions, having no idea what you're getting yourselves into. That's the thing. If you don't know what you're doing, this is brand new field to you, you should not be wanting to work remotely. Because book coding and real world coding are two different things. So sometimes when you're being told no, it's for your own protection. So maybe that was the case in this case, maybe not. I don't know. They didn't say. But I will say this. If you do not want to work in a billing position, do not apply for a billing position. If you do not want to work in any of the alternative positions I'm going to talk about today, do not apply for them. Apply for only the jobs that you want. When you are ready to put that want aside and you say, okay, I need to apply for these alternative positions, that's when you apply for those alternative positions. And guess what? That energy shift that you just did, I don't want this position, so naturally that energy that I'm putting off is, I don't want this. So the universe is not going to give it to me. Now I need to do this because I'm in a no-fail situation. I need to get a job now. Guess what? That's when the doors are going to start opening for you. But until you get out of that mindset of like, I want, you're going to run into a lot of no's. You need to get into that, okay, this is what I need to do. What do I need to do? I need to put my ego aside. I need to put my wants and desires aside so that I can get into the industry. And that may require you getting into a billing position. But again, if you don't want that billing position and you want to apply for coding positions, then you need to make sure that you're applying to these coding positions. And not just looking up medical coding. You need to also look up the alternative names for coders. Medical records technician, health information technician, revenue cycle technician, whatever. They use different names for coders. I know there's a list out there. I don't know where it is, but there is a list of alternative names, and you can Google this, guys. Please don't ask me, because I don't know. If I did know, then I would tell you. But you can Google, alternative names for medical coders, and you'll see a bunch of them pop up. Then you can start looking for job listings under those job titles, so that way you can see what's available out there. But when you keep putting up those barriers of, oh, I only want to work remotely, I only want to work for this amount of money, I only want this, I only want that, when you start putting up all of those things, that's when you're going to see a lot of those stop signs in front of you. Rather than, okay, I have this brand new skill, I'm going to try to work with whoever wants to take me on. I'm going to be joyful, I'm going to be thankful that I'm being given a chance, and I'm going to learn everything I can, because eventually you will be able to get into what you want. Again, I'm living proof, because I said, okay, when I finally put my want aside for wanting to have a full-time job right out of the gate, after searching for 2 months, still cleaning houses, working at the bar, working at a halfway house, doing all those jobs, working 7 days a week, trying to keep my head above water, right? But doing all of those things, I finally put that want aside, and I said, okay, I need to find something. I need this job. I need something. So when I went to the temp agency, they put me in touch with that 3-month assignment, and I went there. I went there joyful. I went there grateful that I was given a chance. And even though it was only 3 months, I was like, you know what? That's okay. I may or may not end up getting this job, because it was like between me and 2 other ladies. So there was 3 of us. We were all brand new. And they said that at the end of the 3 months that they were going to pick just one person to stay on. Well, I really needed to stay on, but they didn't pick me. But it was fine, because there was better out there for me. And then I ended up getting a job that I had to move. Don't tell me you can't move. I don't want to hear it. I'm telling you my story. Okay, because I always have somebody who says, I can't move. I'm not telling you to move. I'm telling you that I moved. So when I moved, and I was in this assignment for 8 months, at the 6-month mark, I started applying. Because I was trying to get back home to my mom, because my mom was sick and I wanted to be there with her. And I was applying, trying to get in somewhere. Still couldn't get into my hometown, but the closest I could get is my forever home here. And 8 months was when I got the yes. I got the interview at 6 months, but I didn't hear anything back, right? And then, like a month and a half later, they opened it up. I applied again, and I got it. So, again, 8 months into it, I'm here at my forever home in less than 1 year. I was able to get to my forever home. So I had to move around a little bit, right? From the original position to this position, this position. But I ended up here. And all because I said, okay, this is what I need to do. This is a no-fail situation now. I can't fail at this. I have to succeed at this. And that's the mindset that you all have to start adopting. Instead of putting out all of these demands. I don't know if it's demands that y'all are getting from like the school. Oh yeah, you can demand all of this high salary and everything like that. When I see some of those salaries that they say that medical coders make, and when they say it's up to, that's the max. That's like in certain areas, and that's like when you've had experience and things like that. But these schools use it as a lure to get people to get in and to sell the dream. That's what they do. That's their job, is to sell the dream. And to me, it attracts those kinds of people that are after those types of things. And when you're so concerned about the money, that's when it makes it harder for you to get the money. Instead of doing your job, which is actually learning the coding, practicing the coding, and working through your workbooks and doing all these things. And then when you're out there and you're applying, then you get your foot in the door somewhere. You start off with a coding position, or you start off with a billing position. You start off with a prior authorizations position, because billing and prior authorizations and claim reviewer, any one of these, billing is obviously billing. You're going to get the codes from the coder or from the provider, because sometimes it's just the provider and the biller acts as biller/coder. and then you process the claims, and then the claims come back and they get paid or they get denied, and you have to look at it and you work denials and doing all these things. That's using your skill. Or you work prior authorizations. Prior authorizations is when the provider gives you a document, which is their notes, and they say, okay, this patient has this condition, I want to do this procedure. You call the insurance company, see if they'll cover it. Well, it is involving codes, and it is involving you reviewing documentation. It is getting you exposure to the electronic health record. So again, all of these things add up to experience, so that when you are applying for a coding position, you already have had exposure to the codes, right? The diagnosis codes and the procedure codes, okay? The other one is a claims reviewer. Claims reviewer, you're working on the dark side. You're working for the insurance company where the doctor's office has submitted the claim to you, and you're looking for things that we can deny them on, okay? Oftentimes they're going to have you run it through a software, and it's going to tell you where there's edits, and you got to look and see if these edits are legitimate, and then if it is, then you deny the claim, because we're not going to pay something that has edits because there's something wrong here. Either the modifier doesn't apply, the diagnosis doesn't apply, the procedure is not supported. Whatever the case may be, that's using your skill as a coder. Okay? So these are 3 positions that I would strongly recommend if you can't get in as a coder right away. And again, these are to help you. Please do not make comments where you're being ungrateful, because you will get blocked. I'm just saying. Because again, I want people to be able to get in and to be able to use their skill. Because if you go into any of these jobs that are talking about, like the jobs that I've said before to avoid, like patient access, where you're working at the hospital and you're working with appointments and things like that, guys, this isn't using your coding skill. It's not using your coding skill. You're not even working with codes. You're working with like patients and appointments and setting it up and doing all those kinds of things, right? So that's not what you want to spend your time on. And if you say, well, no, that's what I did and that's how I got, okay, well then that's you. But I'm talking to the vast majority of the people who are brand new and wanting to be able to use their skill on something. So that way that they can get that experience, so they can get their coding position. And if you got the job doing that, well, congratulations. But that's not the norm, all right? Same thing like patient secretary. Not patient secretary. Well, listen to me. I've got a few other things I've got to do tonight. That's why I'm trying to go quickly. But I wanted to get this video done. The medical secretary, right? Like front desk secretary and that kind of thing. That's not using your skill. And if it is, often what you're doing is you're just circling from a super bill. Again, not using your skill. And you do not want to be a secretary and be a coder at the same time. Oh, well, they'll let me do the coding. No, they don't need to let you do anything. Are they going to pay you like a coder? No. They're going to pay you like somebody who sits at the front desk and checks people in. Not the same thing as a coder. So, no, you're not giving away your skill for free. Okay? Oh, well, they said they'll write me a letter. Do you think that because you're giving them free labor of like your intelligence with the coding, and they start to see their bills start being paid and everything because now they have somebody who's competent to look at these claims before they go to the insurance, and oh yeah, now we're starting to get paid for these things, or we're our denials are lowering because this person who works as a secretary who's pulling double duty as looking as our coder. Do you think that they're going to give you away? No. They're going to keep you on, because why not? What's the saying? Why buy the cow when you can get the milk for free? It's a saying, guys. It's an expression. I'm from Texas. That's what we do. that's a saying that we have. No need to get offended. I'm just saying that don't ever give your skill away for free. Again, not in a multi-billion-dollar industry. You don't do that. You do not do that. So, with that said, you want to avoid those types of positions because, again, it's not going to use your skill. And you don't want to have to give away your skill for free because it doesn't make any sense. It would be better for you to continue looking for work rather than, or get another job in another field rather than give away your skill for free. And the other one is appointments, right? Patient appointments, applying for a job like that. Guys, working patient appointments is very difficult. You have patients who will call in upset, mad, angry, confused, not really knowing what's going on. It's like working at a call center. I have worked at a call center, not for patient appointments, but I have worked at a call center before, and that's a freaking miserable job because people will talk to you any old kind of way. It's horrible. It is horrible. But I'm just saying that if you're working patient appointments, that's not going to use your coding skill. And I guarantee you, you will stop practicing on your coding. Maybe a few of you may say, oh no, I still practice. That's very good. I'm happy about that. But for the vast majority of you, you'll stop. You know how I know? Because I always get those messages from people that says, oh, Blue, I took on this patient appointments or patient access position, and I stopped studying, and it's been a year, and now I'm getting these calls for a job. Oh, what should I do? I forgot everything. How can you forget everything? But I really want to be a coder. If you really wanted to be a coder, then why did you stop studying? Why would you lose your skill like that? Now you got to go learn again, right? Not go through a program, but just go back through your books. You know, I'm just telling you guys these things so that way you guys can be aware, because this kind of like strolling in, oh yeah, I'll be able to get this job, no problem, because I have my CPC and I can be a biller. Yes, sometimes no. Again, it all depends on how your resume is being presented. Your resume is your talking piece without you there. And, I follow a lot of HR people on Instagram, and they're saying, these employers, they take maybe 4 or 6 seconds to look at a resume. So if your resume looks all cluttered and junky, and it's like 3 or 4 or 5 pages, it's immediately going to go into the reject pile. Immediately. And even if your resume goes through one of those ATS readers and it automatically rejects you, it's not an automatic rejection, even though you get the letter that says, oh, we're going to go with another candidate, you don't have experience, that kind of thing. That resume is going to another pile. So there's 2 piles that it'll go into. It'll go into the ones that show on their resume that they're qualified because they have things from the listing into their resume and it's incorporated, things like that. And that ATS reader picks it up and recognizes it. So it has those piles, and then it has the reject pile. But that reject pile is still on file, okay? So it's not unheard of to get the reject letter, and then all of a sudden, 3 months later, they get a call saying, hey, we saw that you applied with us. We would like to schedule you for an interview. Because they either didn't get anybody who applied who had experience that they wanted, whoever applied and they hired didn't work out, and now they've got to look through that pile that was automatically rejected by the ATS reader. So it's not personal, it's just business, okay? So again, if you have a really good resume, that's going to be your key. That's going to open up a lot of doors. As a resume writer myself, I get clients all the time that tell me that. Now, I will never guarantee my resumes. However, I will say that it's happened a lot where they say, Blue, I didn't get any calls. I applied for months. And the second I started sending your resume out is when I started getting calls, and they get jobs. Why? Because I know what I'm doing when I'm writing these resumes. I know, as a health information professional myself, I know what these employers are looking for, because this is what I would look for in a candidate. And everything that person possesses, all of that training, all of that skill, all of their transferable skills, I can see those. And that's why I put them on there. So that's just something that you guys ought to know. If your resume is more than 1 page, you really need to look at it again, and you need to fix it. There's a lot of things online that can help you fix it. There's a lot of resume writers out there. What sets me apart from resume writers, like just regular standard professional resume writers, I'm a professional resume writer myself. But the other ones that are not in our industry is I'm actually in the industry. Okay, I've seen some poorly put together by so-called professionals, and I'm just like, do you even know what we do? How can you write this? You don't even know what we do. It's like, really? I'm just saying. But anyway, that aside, never ever think you're going to be a shoo-in for any job. Okay? Never. Don't ever think that. No matter if you come in with experience or not. Never think that you're a shoo-in for a job. What you want to do is you want to showcase your talents and the things that you know. And you can't be discouraged by one no, by 2 no's, by 3 no's. Because I've been told before, Blue, I applied for 4 jobs and they all told me no. I'm so discouraged. For 4 jobs? My brother, no. No. You have to keep applying. You have to keep applying. Does it go up to 150? I've heard it more than that. But people who are persistent, people who go after these jobs, and like I've said before, if you're applying online, it automatically rejects you, and you really want to work there at that facility, mail your resume, a physical copy of your resume, because that's not getting automatically rejected. That's got to get into somebody's hands, right? Somebody's going to have to get it. Somebody in the HR department is going to get it. And you can put on there the job announcement, please forward to person for job announcement, whatever. You can put that in the envelope. That's just another way to say, yes, I applied online, but I wanted to follow up with this paper copy of the resume. I'm very interested because of XYZ. You don't need to make it a whole big old long thing. That's what your cover letter's for. It needs to be brief and to the point. Now, trust me, if I saw that, if somebody mailed in their resume to me to make sure that I got it, and it's on 1 page and it's got a cover letter that's giving me a brief description of why I would be good for that position, not a regurgitation of their resume, that's the person I'm calling. Because I've got this right in my hand. This person went above and beyond. This person thought outside of the box. Didn't take the no for an answer as soon as it got rejected from the online, applying online. But you got to apply online, okay? So that way you can let them know, yes, I did the protocol like you said, but I would like to follow this up with this paper copy of my resume. It doesn't hurt, guys. I've talked about this before. It can't hurt to send in your resume, to mail it in. And it's not hard to find the mailing address for these hospitals and then just direct it to HR. That's not hard, guys. It's not hard. There's plenty of videos out there on how to address an envelope if that's an issue for you. I don't know. I'm just saying. There's creative ways to get around these things. You have to think outside of the box. It's not so linear. You got to be able to think and be creative and be quick on your feet. Because no one's going to hand you these jobs, guys. No one. No one. If you want something, you got to go after it. It cannot just be that you just give up so easily, or that you are like this person thinking that it's going to be so easy to get in. I guarantee you there's something wrong with her resume. I guarantee you there probably was something wrong with the approach as well, as far as like, oh yeah, I got this coding and I know this. Sometimes when you're describing your skills, that's where it's somebody had a recent graduate from coding school, and they got their certification, and they said that they were asked to go through the steps of how to look up a code, and the person couldn't do it. That's bad, guys. You should be able to, especially if you just completed a program and you've gotten your certification. There's no excuse for not being able to walk somebody through being able to look up a code, a diagnosis code or a procedure code. I'm just saying. With that said, guys, best of luck to you out there. You all can do it. Just stick with it, guys. And there's no time and there's no room, no energy for self-pity, for being frustrated. And if anything, you should let that frustration drive you. It should get you to look at your resume again and think, what can I do to improve it here? How can I make this resume more cleaner? Maybe I should watch Bleu's videos on resume tips for medical coders. I'm just saying. Maybe I should watch Bleu's videos about alternative jobs for new medical coders, or interview tips for medical coders, or anyway, guys, I got a myriad of videos to go through, and the titles are there. You know, there's a bunch of them about jobs and things like that you can check out. And trust me, if they're too long, then you can always hit the speed up button, you know, where you can make it 2 times talking fast. So that way it's quick, you know. I'm just saying. Anyway, with that said, I'm going to wrap this one up. Best of luck to you guys. Have a great weekend, and I'll see y'all next time. Bye.